My name's Roger Halliday, and I'm the Chief Executive of Research Data Scotland. And I'm just going to chair most of the session, but I'll do upfront a very brief introduction to Research Data Scotland and data linkage and the kind of the benefits from that before we get into the meat of today. So, and that the main part of today is really telling you about where we're up to and some of the services and ways of working that we've got. So we've got three main sessions. Each one will do a presentation, and then we'll have some time for questions after that. And just one thing to say up front is that we're going to record the session and it'll be shared online afterwards. And so, yeah, like I say, there'll be a chance to ask questions about each topic after the presentation. So if you want to ask a question, either raise your hand and we'll unmute you. If you prefer, you can type the question into the chat. So we'll try and keep an eye on that as well. And so, yeah, that's the plan for this afternoon. And so I'll get started just in terms of actually what are we as an organisation, Research Data to Scotland? Well, first of all, I'll start with a mission. And a mission is essentially, let's use the fantastic data that we have here in Scotland and put it to use for research that's going to improve lives with a real focus on that public good. And then we've got, I guess we've been set up to be somewhat of an organisation that catalyzes to disrupt ways of working, but to get everybody working together for the benefit of the people of Scotland. So really, I suppose our challenge is that data's locked away in different places. So either whether that's the NHS, whether that's in local government, or other public services, or potentially even private sector organisations, all of which is in slightly different formats. So you have different ways of identifying somebody in the NHS from somebody at school, for example. So that makes it quite difficult to integrate data, but also actually the fact that there's a range of different organizations with the different ways of working also make that quite tricky. So our purpose is to primarily make it easier for researchers to get hold of that data, to access it. We'll say something about the Researcher Access Service and how that actually works in a minute. To then widen the range of data that we've got, and we've got lots of fantastic data here in Scotland that we can use. That's probably, I think, not being used to its full value. And then we're going to deliver a lot of this through the Researcher Access Service. And like I say, we've got a process of transformation that we need to go through that will do that. We'll widen access data to data and speed it up and things like that. So that's what we're about. It's sometimes helpful to think about what we don't do, just to sort of narrow some of that down. So we're not about collecting new information. We're about using the data that already exists around Scotland and making sure that we reuse that where that's in the public good. And the particular, because data means a lot of things, and our particular focus, and where I think a lot of the value is in this, is focused on sort of case level data. So data about a person or an individual business or an individual place, rather than sort of aggregated data that you might see in sort of official statistics, for example. And so just maybe illustrate that with a couple of examples of sort of projects that we've either been aware of or are actively working on. So this is one here around children's services, and really, there's still some significant public policy challenges around equalities and poverty, around childcare, for example, and kind of understanding the transition from sort of birth through childhood into adulthood, and what things that the government's spending money on actually work for whom, and which ones don't. And this is a whole range of data that we've got about children already that's been collected by different parts of Scotland, whether that's government, Public Health Scotland, the police, or National Records of Scotland, who do things like the census. And actually, each one of these is in its own little bubble at the moment, and it's difficult to connect this. But actually, painting what we're able to do by linking up data is paint that picture of how things change over time for an individual child or for a family. And that can help government really understand the causes of some of their public policy challenges. They can help them understand what things actually might work, and actually, when they're put into place, what things actually work on the ground. And because it's very granular data, it's data about individuals, what we've got is the ability to understand what things work for which kinds of sort of people, the sort of backgrounds of individual people. So of course, and I'll say in a minute, what we don't know is who any of these people are. All the data is de-identified, but we've got ways of connecting that data across different systems. Another example here is around healthcare. So what we know is prostate cancer is one of the biggest cancers that around in the UK, and there are particular higher risk groups around age, around ethnicity, and we also know that the radiotherapy as the treatment for prostate cancer, the outcomes from that are they're really variable, but we don't really know why that might be. So this study here, the Prosecco study, brings data together from around 10,000 patients, a whole range of sort of imaging data, regular sort of healthcare service use data, and some data, sort of detailed sort of notes that might be in place about individuals, in order to be able to understand what is it that makes some radiotherapy treatment successful and what things don't, and actually how could that be adjusted for particular kinds of people to improve outcomes and reduce that variability and save lives. Difficulty being that actually the step of bringing those different data sets that I described together took a really long time. So it took 18 months, and we know that 12,000 people die from prostate cancer, sadly, every year in the UK. So actually, speeding up cycles of this kind of research really can have an impact in saving lives much more quickly. And I mentioned that the only thing that we're about, where Research Data Scotland begins and ends, is about accessing data for research for the public good. That's we might want to get into what does that actually mean, and I think what it means, and quite a few people have had had goes at defining that, but it really comes down to, does this improve society by filling gaps in knowledge and making sure, as I was saying, that people that are making policy, people that are developing operational treatments in the NHS or services in public services, actually can do that better, can improve the outcomes of people and their well-being and lives. And that's crucial, because no project goes ahead without an assessment of that public good. And I should have said up front, actually, that Research Data Scotland is a charity, and it's owned by Scottish Government, Public Health Scotland, and the universities of Aberdeen, Dundee, Edinburgh, and Glasgow. And we'll hear in a minute about our Researcher Access Service. Well, that's a service that's delivered by staff in Public Health Scotland using incredibly secure computing that's delivered by the Edinburgh Parallel Computing Centre, EPCC. And the way that we connect data across the different data systems is done by the National Records of Scotland, and they've got expertise in that space because they register births and deaths and vital events. And then a shared ambition for our services in Scotland is very much a shared ambition with others who provide access to data, such as NHS Scotland and university partnerships like the Data Loch, Dash, and the Health Informatics Centre that are based in different parts of Scotland, but also with others that hold data about Scottish citizens or Scottish businesses, like the Office for National Statistics. And really, we're looking to the way that we do this is to align systems and approaches. So our work and the really good work of Health Data Research UK is about doing that, bringing a whole range of organisations together to align how does all of this work, what standards are we working to, what policies are we working to that are both trusted and also are effective in making this kind of research happen. So that's basically the introduction to Research Data Scotland. So what we're going to the way that we work, actually, the final thing I'll say is that we're going to do this, and we have been working in both a collaborative and a transparent way. And we're keen to both keep people updated and enable people to say what's important to them and help us shape our services. So if you were able to and you wanted to, please do help us. I suspect many of you are already signed up to our monthly newsletter, but if not, feel free to scan the links here or to help and shape our work. So I'll just pause there for any immediate questions, but if there aren't any, I feel it would be quite good to get quickly into the Researcher Access Service because this is a key part of what we're about. And I can't see any hands up and can't see any immediate questions. So what I'll do is hand over to Jen Campbell and Adam Coulson, who are the part of the team behind the Researcher Access Service development within Researcher RDS. And like I say, there'll be a bit of space at the end of their presentation to ask questions. Jen.
Hi there. So I'm Jen Campbell. I'm the Digital Delivery Lead in Research Data Scotland, and I'm going to talk a little bit about the Researcher Access Service and kind of more broadly RDS's digital services to support research. And then I'll also hand over to my colleague Adam, who'll talk a wee bit about the service that we've developed. So first of all, if this isn't something you're already familiar with, you might be kind of wondering, what is the Researcher Access Service? So basically, at a really high level, the aim of the Researcher Access Service is to make it faster and simpler to access data to support research in the public good. The service will operate securely, lawfully, and offer an improved end-to-end experience for front and back-end users while reducing errors and duplication. So that's the vision, really, that we've been working towards and that we continue to work towards as we sort of develop the service. That's sort of what we started with, and we're still on that journey of kind of developing this service and making sure that it meets all of those aims that are kind of encapsulated there. So why did we think that a new service was needed? What is this? What is it for? What is it trying to do? Well, what was kind of, I suppose, the situation before we started on this this journey with the Researcher Access Service? There's lots of different routes for accessing secure public sector data for research in Scotland. So Roger talked about some of the different types of data that might be involved here and that people might want to use for research purposes, and lots of them have kind of different ways to get access to them. So that means if you're a researcher, particularly if you want to maybe use different types of data in a research project, which that often would be the case, you might have to engage with lots of different organisations. They would probably all have their own different processes that you might need to follow, different forms to fill in and things like that. And that can lead to long delays in getting valuable research done. And there's lots of costs associated with that. There's the time that researchers spend on those processes, as well as the time spent by staff who have to kind of process and manage those applications. But there's also just the cost of not actually getting the research done as quickly as it could be, or potentially not at all. Maybe if you run out of time, or your funding runs out, or whatever it is, because you don't get access to your data quickly enough, that could be valuable research that either isn't done or isn't done as quickly as it could be, and that some of the insights from that that could be really valuable in changing policy or other sort of outcomes. So that's, I suppose, a bit of the sort of why did we think a new service was needed. So we embarked, I suppose, probably about a year ago, or a bit longer, on a sort of digital service delivery journey. And just for a bit of kind of involvement from everybody, interested to know what you think. When designing a new digital service, who do you think you would involve in this? So I think there should be a poll coming up in the, I think it's in the chat. Yes. And there's options there that you can choose from. So do you think you would involve people who will use the service, staff who will support the service, technology specialists? Give it just a minute or so for people to choose their options. I think there's probably quite a clear pattern coming through here, which is that, yeah, I think it's pretty clear from the responses that nobody's fallen for the trick question, which is that really all of those are correct answers. And along with others, those are three really important kind of groups to be involved in the design and delivery of a new digital service. So we'll talk a wee bit about kind of how we've done that and how we've involved those groups. So listening to users has been really important in our sort of design and development of the Researcher Access Service. There was user research and engagement carried out with a variety of roles, which included researchers, research coordinators, data analysts, statisticians, data owners, and others. Lots of people who kind of work in and around this kind of ecosystem around data access. And just some of lots of findings, just a few on the screen there, included it's difficult to find out what data is available and to actually work out what is needed to get a particular research project done and to answer your research questions. It can be difficult to actually work out what certain bits of data might tell you or not. There was often duplication of effort, so people felt like they were having to provide the same information, and that information might be captured in lots of different places. So that there's also potential there for error to kind of creep in. Applicants couldn't self-serve, so that meant there was lots of emails back and forward, chasing, asking for updates, where's my application in the process. You couldn't go somewhere and check maybe on the status of your application, for example. But also researchers really valued the support and advice that was provided, in the services that were around, and they wanted to see that continue in the new service. That was really valuable. They valued the ability to engage with people who are experts in the data they were looking to access, and to use that expertise to help shape their projects. So the approach that we've taken in delivering the Researcher Access Service, it's been an agile delivery approach, which is a term you may or may not be familiar with, but basically that really means we've been focusing on delivering value as early as possible, and as part of that, learning from real users. So rather than kind of waiting until we had absolutely everything that we might want to deliver as part of this service sort of ready to go, we wanted to get something out there into the world kind of as soon as possible, a sort of first version, so that we could try it out, get feedback, and continue to build on it, improve on it. In order to do that, we've used a low-code development platform, which allowed us to quickly build a working service. So again, rather than starting from scratch and having to build up all the infrastructure and things that sit underneath that, low code just means it's a bit easier and a bit quicker to develop. It does mean we needed to have that input from kind of technology specialists to support us on that journey. We've started small, and we're kind of testing and learning. We're building out the service incrementally, and I'll come on to say a wee bit more about the scope of the first version of the service. As Roger mentioned, we've had really close collaboration with the Public Health Scotland IDRIS team throughout the design and build of the service. So that's the team that supports researchers through the process of applying for data, particularly health data. And they support the Researcher Access Service process and continue to do that. And as I've mentioned, we've been really guided by user needs, and that has included doing testing with researchers. So during that kind of design and development process, we were able to test out kind of early versions of the service and get real feedback, and then kind of feed that into the development. So what is the service that we've developed? What does it actually do? So really it kind of encapsulates that journey for a researcher from sort of discovering what data they might want to use. So we've provided more upfront information about the data and that's available and the processes that need to be followed. And we've also provided a single entry point, which means even if you're not sure if you're eligible for this new service, or you maybe need to go down one of the other approval routes, there's still that kind of single entry point for you to go to. It then goes into an inquiry, so then you can tell us a bit of information about what you need, and then that will go into a triage process to determine the right approval pathway. We've got a full kind of application process which is supported by a digital platform now, and that does allow for things like tracking of your application, you know, seeing where it is, also feedback and being able to ask questions and get support as you work through that application. And the Public Health Scotland IDRIS team are there advising and supporting researchers throughout, so they use that platform as well to be able to communicate back and forward with researchers. We've got a simplified approvals process, and then access to the data is via the National Safe Haven, so that the scope of the service as it is means that data can only be accessed in the National Safe Haven if you're accessing it through the Researcher Access Service. And then finally around outputs, we will come on to talk about this a wee bit more, but we're really keen to work towards more transparency around the use of data and published outputs and outcomes of research. So that's something that we're continuing to do some work on. In terms of the scope of the Researcher Access Service at the moment, as I mentioned earlier, we did take that decision to sort of start small and build incrementally. So our first version of the service, which went live in April 2024, allowed for access to 9 data sets, which are shown on the screen there. So those are some of the most commonly used health data sets, so some of the really common kind of interactions that individuals might have with health services in Scotland, plus we've got the birth registrations and death registrations. So while it is just the 9 data sets, you can see from the kind of range of topics that are covered there that there really is a broad kind of spectrum of different research topics that you might be able to tackle with these data sets. There's full details on our website, including the variables that are available within those data sets and the years that they're available for. And if you've got any kind of specific questions on them, then you can let us know. But that's kind of the scope of the service as it stands, but we will be working towards, and we are currently working towards expanding that to more data sets. So I'm going to hand over to Adam now, who's just going to talk a wee bit more about the Researcher Access Service and kind of what it looks like in practice.
Thanks, Jen. So Jen's talked through the kind of overall journey that a researcher would go through with the Researcher Access Service. So I'm just going to touch a bit on 2 parts of that process. So the inquiry and the application. And so what you can see on screen here is just a screenshot of the initial inquiry that a researcher would submit when they want to access data. So this inquiry form was designed to be as short as possible, so asking only the kind of key details that we need to decide which approval pathway that they should go down. So as you can see there, we're really trying to ask them things like their organisation. We put a lot of value in accredited organisations, so we want to know where they're applying from. Obviously, the data sets that they require, we need to know the kind of data that they want to understand if that can be provided, if that can be linked in the way that they expect. We ask a little bit about their funding as well for the project, so it's useful for the team to understand if they're being funded from a commercial organisation or if it's from a public sector body, because that has impact on the approval pathway that we want to take them through. And also we try to understand where they might want to access the data when it's prepared and ready for them. So within the scope of the existing researcher access service, all the data is accessed in the national safe haven, and that's for good information governance reasons. And so I'll just step forward onto the application process, if you want to move that forward, Jen. Thank you. So if a researcher applies through that inquiry form, and then we deem that they're suitable for the researcher access service, so what they want to do is achievable through the service, they're invited to log in and create an account in the new digital platform and begin to complete their application. So the application form itself, you can see just a screenshot here from one of the test applications. It's structured on the basis of something called the 5 Safes framework. So this is a language that's kind of common to many researchers, and it's really about reinforcing the message of trust in the system. So the 5 Safes framework is a set of principles which enable data services to provide safe research access to data, and they cover off things like safe people, so a principle around the people who are accessing the data, a safe project, the project itself, the data that we provide, safe data, the safe setting being the place where the access is provided, so the national safe haven, and the safe outputs at the end of that process as well, to make sure that they've been disclosure checked and that they're suitable to be released. So Jen kind of mentioned there around some of the functionality around the application. We're enabling a bit more feedback with the researchers. So the team who are supporting the researchers through, they've got a lot of knowledge of the process and can answer lots of questions. So we have comments and messaging features in that process, so they can ask questions of the team and get quick answers to enable them to move through the application much quicker than they might have done previously. And they can also track the status of their application as it moves through. So we did a lot of service design and user experience design work to make sure that the platform was as streamlined and user-friendly as possible. And we've had some really positive feedback from researchers on that, and we continue to engage with them to try and make improvements where we can. Next slide, please. So another part of what we're doing is particularly around transparency. So what does that mean in this context? It's really around making clear to the public, aiding public understanding of the research uses, and ensure consistency across all the different data access providers. So we want to be clear with everyone about where their data might be being used, who's accessing it, and for what purpose. So this, what you can see on screen is what's called a data use register. And this is something that we've recently launched on our website, which essentially lists out all of the projects that are being approved through the Researcher Access Service. And so Roger touched on a lot of the organisations that we work in partnership with, and one of those is HDR UK, Health Data Research UK, and they do a lot of work to publish standards and transparency standards, particularly to make sure that other data providers and data access providers are doing things in a similar way to provide a level of consistency for researchers. So whenever they go to a new provider or a new service, they don't have to unpick it and try and understand it. There's an expectation that there'll be a continuation and a consistency across them, so that it's easier for researchers to navigate and work with those organizations. So they've produced some transparency standards that we've leaned heavily on in the design of our data use register and some of our other digital content as well, to make sure that it's as clear as it can be and that we're providing the right information to the public. So we're updating this on a regular basis as projects are approved, and we're thinking about how we can improve this in the future around using things like digital object identifiers, which will help us stitch together the journey from a research data set all the way through to the outputs and the most important element of public good at the end. And so another aspect of our digital service that sits quite at the start of the journey for a researcher around the sort of data discovery end of the process is what's called a metadata catalog. And essentially what this is it's a catalog that displays information on the data sets that are available for research published by various public sector organisations across Scotland. So this isn't just the data sets that are available through Research Data Scotland and the Researcher Access Service, but lots of other organisations too, like Public Health Scotland, Health Informatics Centre, Datalock, and others. So again, we've done extensive usability and accessibility testing to make sure this is as good as it can be for all different kinds of users. We have a commitment to user-centered design, and this went live with our website last year, and we're currently working on improving it with a view to adding more data sets and connecting to other sources to provide richer information. It's worth saying we're part of an ecosystem in this respect, because the data that we have here feeds into other catalogues, like the ADR catalogue, and we pull information from other catalogues again, like the HDR UK catalogue. So again, just trying to provide the richest kind of data set information for researchers. So whether they find that on our site or others, we want to try and connect to the different services together to give the best visibility to researchers. So what's next for the service? Well, we're obviously trying to expand the types of data available through the service. When Jen described the scope being 9 data sets published by Public Health Scotland. So that's the initial data set list, but we're working with data controllers to bring them on board and provide access to more data within this pathway. And again, as we mentioned, we're speaking to our users on a regular basis, both the back-end users of the service and research customers as well, to try and get their feedback as much as we can and use that to improve the overall digital journey. And again, we're really keen to think about how we demonstrate that impact in the long term, thinking about the different methods and ways we could try and do that too.
We'll hand over now to Sophie, who's going to be talking to us about synthetic data and the potential benefits that this will bring to users. Okay, Sophie.
Hi. So let me introduce myself. I'm Sophie McCall. I'm a senior data analyst with Research Data Scotland, and I'm coordinating the work being done with synthetic data. Now, firstly, can we answer a question? We've got another poll for you guys. Have you heard of synthetic data before? So I think the question is coming in the chat. If you haven't got access to the right technology, maybe just put a thumbs up in the chat if you've heard about synthetic data before. It's looking good. Fantastic. So at least 2/3 of you seem to have heard, maybe more, maybe 3/4 of our audience are aware of synthetic data. Fantastic. But what actually is synthetic data? Maybe we've heard of what it is, but we don't really know what it is. So hopefully it's an opportunity for me to explain a little bit about what synthetic data is and what we are doing in Research Data Scotland around it. So here's a definition of synthetic data. Synthetic data follows the same pattern and structure as real data that they're based on, but it doesn't actually contain any real information about the people. And that can be a bit of a confusing concept to sort of get your head around. So it looks like real data, but actually it isn't the real data. And there's something that some people might be aware of, a concept about the fidelity of the data. So you might have heard of people talk about high fidelity synthetic data sets and low fidelity synthetic data sets. So I'm trying to see if I can demystify that a little bit for you. You can see my picture in the on the screen here. I would say that I'm a fairly high fidelity image. I've got a blurred background, so I'm not the real thing, but pretty high fidelity. But if I do this, I think I'm pretty low fidelity. So maybe that gives an understanding of the difference between what high fidelity and low fidelity is. So an important part of the work that we're doing in Research Data Scotland is making available synthetic data to our researchers. Why are we doing this? Why we're doing this is because if researchers can refer to their synthetic data before they have access to the real data, they can start work sooner on their research. And, you know, wouldn't it be awesome if we could have synthetic data sets made available alongside the researcher access service, which Jen and Adam have just been talking about? It's one of those things that we can do to simplify the process in getting researchers access to data. That is very much our ambition. And we're starting on that journey. We're not all the way there yet, but that's why that's what we're trying to aim for. So when we started this journey, we engaged with our users, and there was a very clear desire that having low fidelity synthetic data made available would be what researchers are interested in. So the level of fidelity that we would be looking at is just enough to allow the researchers to get a feel for the data and make a start in the code development. And that's what we're working towards. And our user engagement has shown that there is much less interest in the high fidelity synthetic data. Now, this is really good news because the low fidelity synthetic data is much easier to create. It doesn't need sophisticated and expensive tools, and therefore the risk of identification of individuals is much lower. We've done some public engagement as well as other organizations, and the public seem to be much more comfortable with the idea of using low fidelity synthetic data. So this is all very positive, and that's why we're designing our approach using a low fidelity approach. Now, the thing that we found is you don't actually need to see the real data to generate low fidelity synthetic data sets. And in some cases, you can generate synthetic data just from the metadata. Now, this is the data about data, which can be publicly available. And I know Adam's just mentioned about our metadata catalog. So that's got a lot of information about data that's publicly available, and that can be used to generate synthetic data. In RDS, we're using the R programming language to generate our synthetic data. You can use lots of other tools, but we're choosing to use R to do it. It's publicly available, and it's something that lots of people have lots of knowledge on. And what we're doing was starting by looking at some of the education data sets that are available in the ADR Scotland catalogue, primarily the pupil census, but also data sets around school attendances, absences and exclusions, and others well within the within the education sphere. Now, once we generated our synthetic data, a very important part of the work that we're doing is looking how we quality check the synthetic data, because although it's low fidelity, that doesn't mean it's 100% risk-free. We need to be sure that what we're doing is as safe as we possibly can make it. So we're making sure to check that the variables we're using are synthetic, they're not the real data. And we're having a look to understand how the synthetic data reflects the real data. What is that fidelity that we are generating to make sure that it's matching our requirements? An important part that we are looking at is there any missing data in our real data, and is that reflected in our synthetic data? Because that's an important thing for researchers to understand. If they want to develop code, they'll need to know actually, does this variable actually contain missing values, and how much of that is missing? And finally, a really important part is the disclosure checking process to make sure that people are not identified. Finally, just some information around the wider work that we're doing around synthetic data. So as well as creating synthetic data sets, we're also doing lots of other activities around synthetic data. Firstly, a quick word about our Synthetic Data Fund, which we launched in January 2024, where we awarded £86,000 to 3 organisations. They're doing work around synthetic data in Scotland, around disclosure risk and IG, synthesis of data, and access, promotion and engagement. So 3 organisations that have been supported by RDS are Police Scotland, who are looking at generating a synthetic data set of incidents, crime incidents, Dash, one of the safe havens in Grampian, looking around some of the information governance and how to make synthetic data available, and the Cypher project in University of Glasgow, who are looking at sort of opportunities to link synthetic data sets with other administrative data sets. And finally, some other pieces of work. We're also working with National Records Scotland to make available a synthetic data version of their census data, which we're hoping to put through the metadata catalogue that Adam was talking about. We're also hosting some synth pop and synthetic data workshops, which have been hosted by Professor Gillian Raab. We're also contribute to UK-wide public engagement work as well around synthetic data. And I will leave it at that. And if anyone's got any questions, please shout.
And go on to our final presentation, which is around public engagement. And yeah, so we're going to invite Katie to join us now. Clearly, we need to demonstrate the trustworthiness of using sensitive data about individuals and businesses, and to know what's the right way of managing that, and that's therefore a key part of that's public engagement. So fantastic, Katie. I'll leave you to present and then to do some Q&A on the back of that.
Great, thanks, Roger. Hi, everyone. My name is Katie Oldfield. I'm the Public Engagement Manager at Research Data Scotland. So I'm going to talk you through some of the ways that we are carrying out public engagement to RDS, and some of the areas that we're interested in, and a little bit about our public engagement fund that we have at the moment. So as Roger alluded to there, as part of our aims at RDS, we're committed to embedding public engagement. We're very aware that the data that we use is data that's collected about the people of Scotland and made available for researchers doing projects that are in the public good for the people of Scotland. So we should be speaking to the people of Scotland about it. We know from existing public engagement work and things that we've carried out ourselves that broadly the public is supportive for the use of data for research, as long as these three conditions are met: that, as I said, data is in the public good, that there's privacy and security around that data, and transparency and trust is really important. On the screen, you should be able to see so our approaches to public engagement. There's sort of three different ways that we go about it. One is to involve members of the public in our work. So we run a public panel, which I'll speak a bit more about, called Scotland Talks Data. We also often have public members on project teams, so attending meetings and getting directly involved with our work, offering feedback on things, contributing to scripts for videos and website content as well. So we don't just sort of drop in and out. We have public members more directly involved in what we do. We also aim to go wider than that as well. So we aim to engage with wider members of wider members of the public. So that includes the work that our communications team does. So you have had some links to the chat to our website. On the website, you'll find explainer pages, videos, and wider comms. These are all made to be publicly accessible to help that transparency element of what we do and build that trust with people about what is happening with data. So the data use register that Adam spoke about earlier is part of that as well, just being really clear about how we're handling everything. And our public engagement fund will also help that as well, and I'll come to that a bit later. We also make sure that we don't work in isolation. There's lots of people across the UK and indeed globally that are doing public engagement work, finding out what people want. So we are part of a number of networks, including PEDRI, Four Nations, PPIE1, ScotPen, the TRA community, to make sure that we're not duplicating work and that we're really building and learning from other places as well. So I'll just go into a bit more detail of some of the things that we've done recently. So as part of our engaging and communicating a bit more widely, we recently took part in Doors Open Day in Edinburgh. So this means the building, the Bay Centre that we're based in, is open to the public. And we trialled 3 different activities. You can see them on the screen there. It involved Kaplunk and Lego, which was for a big hit with grown-ups and kids, that helped show how we keep data safe and the potential for the use of data as well. This was a bit of a pilot for us. We'd like to attend future events, other public events, festivals, that kind of thing. So we're always open to suggestions of anywhere that we could go. Over 100 people engaged in just a few hours, and we got some really positive feedback from that as well. I mentioned before that we try and directly involve the public in what we do. So we co-run the public panel Scotland Talks Data with SCADA. We've done that since 2023. So at the end of last year, 20 people were recruited to the panel. We did this through a postal invite to sort of diversify the kinds of people that are taking part. And we recruited 20 people with a range of lived experience around Scotland. One of the benefits of jointly hosting this panel with SCADA is that the panel discuss the full data journey. So everything from data sourcing, how data is stored, how it's handled, how researchers access it. Plus, researchers also come to the panel. So the panel hear about what actually happens with the data by researchers, and then give feedback on how researchers should communicate and disseminate that as well. So they really get to see the full life cycle of the data and are able to make informed input into that. The panel members stay with us for 2 years, and then we re-recruit just to make sure that we're getting fresh voices into that as well. Old panel members are given the opportunity to be involved in projects in the future. All of the Scotland Talks Data panel topics that we talk about are on the website. If anyone's interested in finding out more, there's also contact information, and we're normally happy to share, as long as we have the permission of presenters, what we've learned through that panel and the summaries. So some of the things that they've spoken about in the last year are the Researcher Access Service. We actually had a session yesterday, seeing some about the Researcher Access Service and getting some feedback on different points for our future plans. They've heard about a number of research projects, including the brain health pilot, mental health and policing, and household living arrangements and COVID-19 among disabled people. So as you can see, a real range of topics. I also mentioned before that they help us with communications material. So as part of that transparency, we want to make sure that all of our material is actually suitable and understandable by everyone. So the public panel help us with that, call us out when we're using too much jargon, and make sure that everything's really clear. The screenshot that's there is from some animations that we did with some HDR UK funding, where public panel members contributed to the script and also to the rough drafts of the animations as well, giving really valuable feedback. These are some of the topics that we're really interested in over the next year or so, and I'm sure further as well. So synthetic data is one. You've just heard from Sophie about our plans for synthetic data. There's UK-wide public engagement going on that we're taking on board for our synthetic data plans at RDS. And also we'll be talking to the public panel about how we're implementing that advice from that wider UK work. The Researcher Access Service is a big topic at RDS over the next couple of years, and our public panel will be heavily involved in that as well. Private sector access, I spotted those questions about that in the chat, and Roger spoke a bit about that earlier. We know that this is an area that the public are really interested in and can have some concerns about. So how we manage private sector access, and again, that transparency of what we're doing is really important. So we'll be involving members of the public in that and doing some wider public engagement work beyond our public panel about that. We know that AI is an ongoing topic as well, so we have plans to discuss that. And we're also involved with a project to do with federalised access across the safe havens, and federalisation is an important topic as well. So you might have noticed I didn't have a poll at the beginning of my my presentation, but I do have one handily here in the middle. So there's some of the things that we have been talking to the panel about and that we're interested in over the next year or so. And you've seen some of the topics that we have on our website that we talk about, but we're interested in knowing, what would you be interested in hearing about? What would you be interested in us making more kind of videos about, or having on the website, or doing more public engagement around? So it should be a bit like before. You should have a panel on the screen or in the chat. I saw some of you were struggling to take part in the polls, that they weren't working for you, but if you've got any suggestions, you can just pop them in the chat or pop them in the poll, and we can see. It's really helpful for us to see what people are interested in, so that we're creating content that will be useful and that people are interested in. So we're delighted to see synthetic data was so quickly up there, and we'll definitely be doing more around synthetic data. We do have a nice explainer on the website and an animation about synthetic data, which is really helpful. And data linkage and health interventions and GP data. Oh, I'd love to see that social license is up there. That's a big topic of mine as well. So we'll just leave that up just for people to put in. Genomics data has been put in the chat as well, which is a really interesting area, and again, a tricky one to explain. So it's good if there can be more content about that. So I think I'll move on now to talk about our public engagement fund, which is something that we have open at the moment. So our public engagement fund, we ran a pilot version of this last year in 2023. We had over £56,000 awarded to 8 different projects. And each of those projects had a different topic area. They took place in a different area in Scotland, and they aimed to engage different areas of the population. We did it, as I said, as a pilot, just to see how it would go, and the projects really exceeded expectations. They reached over 2,700 people across Scotland, and that's probably a conservative estimate. There was lots of different types of activity taking place. One of the really important things we liked from the project was we were very flexible in how people used it. So we really wanted people to have the opportunity to form partnerships and to try new ways of doing things, whether that's new creative methods for engaging with people or bringing together different groups. And on the screen is a quote from one of our projects, which was that this is the sort of research project I'd hope would be possible over 10 years ago, but never seen it until now. And that's because that project was able to use sort of new creative methods. We have lots of information on the website about the projects that took part, including short videos from each of the project leads. So if you're interested in finding out about any of the ones that took place last year, you can take a look on the website about it. There was a really nice range around Scotland and of different topic areas as well, and different audiences. Some of them really focused on engaging with young people, such as Generation Scotland, the Data and Biological Research, and the Data Linkage Shine project. They really focused on young people. Other ones engaged with particular groups that they were interested in talking to about their data and how it's used. So How Fair is North East Scotland and My Data both focused on particular kind of groups of people, doing a bit more in-depth discussions about it. And Mental Health Imagining Beyond also engaged with particular groups to test new creative methods of engagement as well. Many of these, what we found, a lot of the value was in building new partnerships with organisations, and a lot of these projects, even though the funding finished last year, have carried on their work and are seeing ongoing benefits to it. So fortunately, it was so successful, we were able to bring it back this year. So we have a total of £30,000 available Organisations can apply for £1,000 to £10,000 to deliver new work or build on existing projects. We know that it can be difficult to get funding to carry on existing work that's already successful. The applications are already open. They opened at the start of September, and they're open until the 14th of October. So it's definitely not too late to apply. So what are we looking for from applications? We would like the applications to cover some of these aims for the Public Engagement Fund. So communicate the impact of data research, showcase cutting edge data research, new projects, linking new data together, new ways of doing things, anything like that we'd love to see. Projects that involve new audiences, voices that aren't normally heard in data research or wouldn't normally engage with data research. Any projects that focus on that would be great. And also I've mentioned a couple of times about creating new partnerships. So building new relationships with community groups or different areas around Scotland. There's an extra new bit to this year's fund. You might have noticed on the screen before, a lot of the applications came from universities and researchers, which we definitely want to encourage again this year. But we're also wanting to see some community-led projects, but we know that this is maybe an unfamiliar area for them. So we have a community fund this year where a community group will get additional support through the length of their project. The projects, the key dates, if you're interested in applying, is that the applications will close on Monday, the 14th of October. Projects can begin from January 2025 and end no later than January 2026. They can start or end any time in that, though. They don't have to be a year long. They can just be up to a year long. If you're interested, there's a QR code there, but there's loads of information on the website about who can apply and all of the kind of rules, and as well as the application form and guidance if you're interested. Up on the screen are a couple of different ways that you can get in touch if you have follow-up questions. So we've got a lot of information on our website. You can also follow us on LinkedIn or X. And one of the best ways to find out about what we're up to is our monthly newsletter, where we talk about our current work, our future plans, and any ways to get involved in our future projects. So thank you very much, everyone, for coming and all of your great questions, and look forward to seeing you again at a future session.